and welcome back to Freedom from Fire. I will be your host, Lieutenant Lisa Desamour. I'm currently stationed in our department's Fire Prevention Division, where community risk reduction efforts are a primary goal. We aim to improve your quality of living by giving you fire and life safety information. We also introduce you to our local safety partners. During the pandemic, the Philadelphia Fire Department, like most public safety agencies, are responsible for working with government and public health officials to assist in containing spread while still serving our local communities. Having needed to adjust rather quickly at the onset of the pandemic, we are continuously evolving in a seemingly constantly shifting environment. Public safety agencies are engaging with new and evolving priorities, which will probably lead to fundamental changes in our cultural norms, societal values, and even behaviors. The scale of these changes, however, suggests a potentially permanent shift to new ways of working and living for most citizens. Virtual meeting sessions for work or celebrating even a birthday, and even virtual classrooms seem to be an appropriate and acceptable new norm of communication today. On this segment, I will speak with the Philadelphia Fire Commissioner and Director of OEM, Office of Emergency Management, Adam K. Thiel, about the department's role during the pandemic and the possibility of any changes. So without any further hesitation, I'd like to welcome Commissioner Thiel, and thank you so much, Commissioner, for taking time out because you are a very busy man.
Thank you, Lieutenant, and thank you for keeping the show going without a pause through the past year. Very important. I've watched every episode, and thank you for all of your hard work over the past year as well.
Thank you. That definitely means a lot to me, Commissioner. It really does. To start off our session, the first question I'd like to ask is, in the beginning, I don't think a lot of folks really understood the severity of the pandemic. From a public safety perspective, what were your initial thoughts?
So, in our business and fire and EMS and emergency management, it's kind of part of our skill set to always be looking ahead and thinking about the next threat and thinking about worst case scenarios. So honestly, I think we had been watching COVID-19's progression for some time and planning to the extent that we could. So when we finally got that call a little bit more than a year ago that the first case was identified here, first confirmed case identified in Philadelphia, I feel like we certainly, as the fire department, EMS and emergency management, were pretty well prepared, at least for the initial impact. We had enough PPE. We had been stockpiling PPE. So we were able to help not just protect our almost 3,000 women and men as we continue to do our daily mission, 800 to 1,000 times a day. We were actually able to share PPE with other city agencies. And then a lot of our work really turned to supporting all of the other things that the city needed and all of our partners needed during COVID-19, whether it was getting laptops to kids. We had firefighters taking laptops to children when schools closed. We had firefighters and emergency management staff handling mass feeding operations, those feeding operations that we as a city did a lot of work on that in the initial months. Now a lot of that's been turned over to not-for-profit partners. We talked about the PPE, sourcing and distributing PPE from all over the world. We have our logistics team was looking at PPE in India, China, and everywhere in between. So we were doing a lot of things that I think folks don't typically consider part of our mission, but it's what we do 24/7, 365. If it's something to help protect our residents, businesses, and visitors, that's what we do.
Absolutely, and I agree with you on that. I don't think a lot of folks do recognize or even realize a lot of the extent that we're involved in when it comes to public safety, especially in relation to the pandemic. How important is it for leaders to immediately acknowledge and respond to crisis? And with this question, Commissioner, not just the crisis, the pandemic now, but just in general.
Well, I think it's pretty important to acknowledge that, and really, I think to kind of see these things coming. And over the past year, in addition to COVID-19, of course, we've dealt with a lot of other things. We did a lot of support for the elections. We had a Hurricane Isaias, hit us here in Philadelphia. We actually did 200 water rescues on that day between the Eastwick neighborhood and Manayunk, so different parts of the city. We had a tornado strike in Northeast Philadelphia on that day. Of course, we had a couple rounds of civil unrest after some really tragic deaths. So that was another thing that we got involved in. We've done a lot this year. And in addition, our core mission in the fire department has never stopped. 362,000 calls for service received, almost 50,000 fire incidents, and almost 300,000 EMS incidents. So we never really slowed down during COVID. We dealt with a lot of other issues. And I think, to your question, part of that was really making sure that we have robust communication. We continue to work and kind of leverage our culture, the can-do attitude of the women and men of the Philadelphia Fire Department. I just can't say enough. Our dedicated Office of Emergency Management staff. A lot of folks don't know what OEM means, but I can tell you that group is a very small but mighty group, working very closely with the fire department and other partners to do all kinds of missions. In fact, the reason that I'm on my phone right now is I'm at one of our brand new facilities at 7,800 Ogons here. It's a joint fire department and health facility. Will ultimately be the home of our recruitment unit and our EMS regional office. Right now, yesterday, we launched a vaccination clinic here that's being fully staffed by the fire department and Office of Emergency Management, one of 3 clinics that we are fully staffing, and also, of course, supporting public health. We have firefighters and medics right now at the Leah Corris Center, supporting the Black Doctors COVID Consortium. We've been doing pop-up clinics in churches, and we're working on a homebound vaccination mission. So if you had asked me a year ago if I thought we would have firefighters and medics working on vaccinating folks against COVID-19, I'm not sure what I would have thought about that, but it just makes sense when you consider the dedication and the skills of our medics and our EMTs, our firefighter EMTs, and really all of the folks who are helping make these clinics work. It just kind of makes sense. And I think really the important aspect of leadership that we're seeing is the fact that leadership in the Philadelphia Fire Department, Office of Emergency Management, is being exercised at every level of our organization. Our folks are stepping up to get the job done, no matter what the disaster, no matter what the crisis. And that really is what the essence of leadership is about to me. It's what those women and men on the front lines are doing every day, 24/7, 365, serving our citizens.
And really quick, too, I want to add before I forget, and you already put it out there, Commissioner, shout out to our mighty but small but yet mighty OEM group, because a lot of times people, they're the unsung heroes sometimes, and they really work hard and they do quite a bit with us as well. So I definitely don't want to forget our OEM folks, Office of Emergency Management, for those that aren't really familiar with who they are. And also during the pandemic, because it has created so many other issues here in the city, we're expected to still provide the same services. So we're still, a lot of times people don't recognize, we're still responding to the fire calls. We're still responding to the EMS calls. And you really perfectly led into the next question in that what role has the fire department / OEM helped serve to mitigate the effects of the pandemic here in the city?
I've mentioned a few things, and I'm really excited about our increasing role in vaccination. As we get more vaccine, different types of vaccine, it's honestly, I get a little emotional when I come to our neighborhood vaccination clinics, whether it's a church or here at our facility at 78th and Ogons, because you see folks who, many of whom have been in their homes for a year. We don't really get to work from home. So for us, we've been continuing to work, continuing to get our mission. I just can't imagine what it would be like to have to be essentially quarantined like that. So it's just amazing to see. One woman came and got vaccinated and said that she was able to go home now and hug her grandbabies, and who she hadn't seen in a year. So for us, this is why we do what we do, to give folks quality of life that they need. Now, I want to make sure everybody understands I'm sitting here in a room by myself. So I'm not wearing a mask, but I do have a mask. Even though I have been vaccinated, it is really important that we continue to wear our masks, that we continue to maintain social distancing. As Dr. Farley, our health commissioner, is fond of saying, we might be done with the virus, but the virus is not done with us. So it's really important that we continue to take those precautions. And I also want to encourage folks to get vaccinated. There are many different sites across the city where you can get vaccinated. We're opening more and more neighborhood sites. We understand that it can be a day trip to get to the convention center. that site that FEMA is operating, which is why we have opened fire department sites here. 78th and Ogons, we're doing some work at Constadters in the Northeast, Salvation Army at 55th and Market. We're doing pop-up clinics at a number of churches. As I said, supporting the Black Doctors COVID Consortium, not just at the Leah Core Center, but some of the other locations that they're doing vaccinations. So please figure out how to get vaccinated. These vaccines are safe and effective. It's really important, and I understand the reluctance that folks have about getting vaccinated. We've been at this now for 3 or 4 months, and it's important that we take advantage of that. So that's really the big thing that we're doing now is around vaccination, which is it's nice to be doing something proactive. Over the summer. Another thing that we did, we essentially built with a lot of partners the COVID surge hospital at the Leah Core Center over the summer. We got some medical equipment from the federal government. We had some soldiers, sailors, airmen, and Marines from the Department of Defense, clinical staff who were there at that site. A great partnership with FEMA and the Pennsylvania Emergency Management Agency, our Department of Public Health. We even had the stagehands union. They were actually doing the rigging for running the oxygen line. So it was pretty awesome to see that facility come together. I'm really glad that I think the most patients we ever had in there was maybe a dozen, that we didn't get to the point where we had to use that facility at the scale that we were concerned about. Now, I want to reiterate, case counts are climbing again as I do this broadcast here at the end of March. So we really want folks to be careful. These variants are out there. Get vaccinated, do all those protection things. I'm really happy and excited about doing the vaccination mission. We really don't want to get to the point where we're having to do another surge hospital. And of course, for us, the fire department has been hit pretty hard by COVID. A lot of our members were affected by it in one way or another. And of course, we lost 2 of our firefighters to COVID, which is obviously the worst thing for us is to lose one of our brother or sister firefighters, especially to something like that. You know, this dread disease, can't see it. We know we're being exposed to it. So we've done pretty much anything and everything you can imagine around supporting the COVID mission. While we've continued to respond to those 7 or 8 working structure fires every day, 800 to 1,000 EMS incidents every day, and whatever else comes along.
Okay. And Commissioner, I definitely want to thank you for promoting, the vaccination. And we understand. And when I say we, you, everyone here in the fire service, anyone in public safety recognizes, the hesitation that folks may have and the apprehension. But we definitely encourage that. And my mother, same, was very hesitant, was nervous. She did make the decision to go and get vaccinated. And she praised the folks down at the convention center. I mean, she couldn't stop raving about them. You would think they treated her to a meal at a 5-star restaurant. But just to put that out there, because she was, she's always under the assumption, that I can go and personally thank everyone for her. So I guess this will be my shout out version for her. So, it definitely is something that's not unrecognized for folks when we talk about the apprehension and the nervousness. But definitely, get out there. We want to return back to a normal life, so to speak, whatever that new norm may be. However, we're going to take a short break, and when we return, we'll keep this quite informative conversation going. So please stay tuned.
As birthplace to the first volunteer fire companies, Philadelphia is home to one of the nation's premier fire museums. Fireman's Hall Museum displays the city's fire history in addition to promoting fire safety. You can visit Fireman's Hall Museum in Old City at 147 North 2nd Street. Visit firemanshallmuseum.org to learn more, or watch the museum's show, Curator's Corner, on LaSalle TV.
Welcome back to Freedom from Fire. I'm your host, Lieutenant Lisa Desamour. Commissioner Thiel has been giving us quite a bit of information and some insight on fire department initiatives during the pandemic. So we're just going to jump right back into our Q&A here, Commissioner. The department OEM has been helping. We were just briefly speaking about the vaccination efforts. Could you tell us exactly what the fire department's role is with those vaccination initiatives?
So we have been supporting other agencies since day one of COVID-19 And it was that way during the vaccination effort until recently. We were moving vaccine around, a lot of getting vaccine from place to place. That's being done by fire department and OEM staff. You know, we're good at moving things around. We're good at logistics. And we've been helping with line management, and we've been helping, of course, provide emergency medical services at clinics and making sure that folks are safe. If there is a reaction to the vaccine, which is a very rare thing, all of these clinics have access to emergency medical services provided by our very own dedicated paramedics and EMTs. So, you know, we were doing a lot of that. And about 3 or 4 weeks ago, after we were able to offer the vaccine internally to all of the members of the fire department Office of Emergency Management. So I waited until everybody had been offered. I actually went on the last day of our first round of clinics. So all of our members could have that offered first before I got vaccinated. And once we did that, we pivoted to, because it's in our skill set, we deliver all kinds of medications. We provide critical life-saving emergency medical care 24/7, 365. It just made sense for us to be doing vaccinations proactively. So our very first fully fire department staff clinic was actually at the Northeast Baptist Church in Frankfurt, right down the street from Engine 14, Ladder 15, a few weeks ago, and we've been just rolling on since then. We opened a clinic. I mentioned those other clinics, and what we're doing essentially at these clinics that we're operating, we're doing everything. We still want to encourage folks. We're doing registration is all going through the health department. As you can imagine, tracking these vaccines, that's very important. So we're encouraging folks to go to the health department's portal and register, or call 311 and register. But when you show up at the vaccination site, if it's one of the fire department and OEM vaccination sites, the first thing you'll see is a uniformed firefighter EMT greeting you, walking you into the site. These are all accessible. So if you have a wheelchair or a walker, don't let that slow you down. If you can get here, we'll get you to the site. And you come in, sit down and relax. It's not, generally, we have not had long lines. Folks are really doing their part to move things through quickly. And you'll sit down with a couple of friendly firefighters, and one of our paramedics will actually do the vaccination. And this is all under the skilled oversight. We have an incredible COVID-19 task force. Our infection control officer, Captain Smallwood, she's both a nurse and a paramedic, very experienced. We have a great team that's working on this. So you're really getting excellent clinical care, just like we provide 800 to 1,000 times a day for any other type of emergency. But here we're able to proactively help prevent the virus from taking hold in the first place. So we've been getting rave reviews about the experience. And again, that's really a credit to the leadership that I was talking about from all of our members. It's service with a smile, to the extent you can see a smile under a mask. So we're smiling with our eyes, but we're really happy to have folks come out. And, one of the great things for us, the fire department is the most trusted city agency. And we appreciate that trust. We value that trust. We cherish it. And we hope that, if you're concerned about going to another site, and there really is no reason to be, all of these sites are doing great work. Anywhere you go, you're going to have very skilled clinical professionals. This vaccine isn't just going anywhere. All these sites are vetted. But if you're really concerned and you want to have that experience with a uniformed member of the fire department or Office of Emergency Management, then come on to one of our sites.
Okay. This is perfect in leading into this next question. Do you believe that local stakeholders, and state official partnerships are necessary to assist in flattening the curve? And if so, why?
Absolutely. In fact, the place that I'm sitting is an example of those partnerships. 2 years ago, we came to this building. This is an historic building in this community at 78th and Ogons. The building is actually owned by the Mount Airy Church of God in Christ, and they had a vacant space. We were looking for a spot in the community, in a neighborhood, for our recruiting unit. We want to be close to folks who are thinking about a career in fire and EMS. So we were looking for kind of a ground level site to be able to do that. We're also locating our EMS regional office here. And a lot of what we were getting this facility for was for community outreach. We're going to be doing community CPR classes here. community EMT classes here. We're going to have our great fire explorers here. So they'll have plenty of space to spread out and do their training on the weekends. And over the past 2 years, this has been a partnership between the church, our district city council member, Sherelle Parker, just incredible. She and I walked through this site at the beginning together and thought about this vision. The Department of Public Property, which is the city agency that actually does buildings for us. They own or operate all of our buildings. The health department, we brought the health department in as a partner. They have a space also in this building where they have their restaurant inspectors are located. So there are, when you add it up, we just did a press conference out here with the mayor and Dr. Farley and the bishops and the council member and our state rep too, Chris Robb. It took all of those partners to make this facility a reality to help serve this community. It's not a firehouse, so it's a little bit different type of facility, but this is a way that we can do community outreach, be in the neighborhood, just like we are at our 63 neighborhood firehouses, and provide all of these services where they're sorely needed. And what better way to launch this community facility in this historic building than with a vaccination clinic? But it's those partnerships and those relationships that made this facility happen, and just in time for us to launch our third fire department operated COVID-19 vaccination clinic today.
That's amazing. And that just proves, and it goes to show that, partnerships are necessary. Community partnerships are necessary. Whether it's at the local, state, federal level, you need that network to be able to get things done in the community. So we briefly kind of touched on this, Commissioner, but to go back to it, when I mentioned how we're still expected to, handle business as usual, so to speak. However, has there been any changes to the department? Has the pandemic affected any protocols, any procedures, or anything like that?
Well, a little bit. I mean, we were kind of early adopters with wearing the masks. Did I mention, wear your masks? So we were early adopters with that. Thankfully, as I mentioned, we had plenty of personal protective equipment for our mission. So our medics and EMTs, as they do incidents, our firefighter EMTs probably are wearing the N95 masks more than maybe they would have been before. That's something you might see. We also we have what we call self-contained breathing apparatus for firefighting. We leveraged a component of that, the face piece, and we purchased a different type of respiratory protection equipment. So you might actually see an EMT or a paramedic come into your home with, it kind of looks like a gas mask, but it's not, and some cartridges in it. And that really was a way that that's a reusable piece of equipment instead of an N95 and throwing it away. So that really led us kind of being ahead of the curve on that. We were one of the first fire departments to do that. And actually, thankfully, talking about partnerships, the FEMA, we got a grant to actually purchase a lot of that equipment, a pretty substantial grant. So FEMA has been a partner with us throughout this entire thing. Also, PEMA, the Pennsylvania Emergency Management Agency. So you might see some different, maybe more personal protective equipment than we usually wear. We've had to close firehouses for isolation and quarantine. We've been very careful about protecting our members' safety as much as we can. Again, it's a challenge. When you live in a firehouse, you're working with a team, you're in close quarters. So that's been a real challenge for us. And I have to say, again, talking about partnerships, all of our labor organizations, our subject matter experts here working together on that COVID task force has really helped us to get through this without missing a beat. There has been no time where we've had to take frontline response units off the street because we didn't have enough staffing. So our members have continued to raise their hand and say, put me in, stepping up, whether it's coming to do a vaccination clinic, take an extra shift on a medic unit or a fire apparatus. Really, all of this comes back to the dedication and service of the women and men of the Philadelphia Fire Department and OEM, almost 3,000 strong. And it's because of them that we have not missed a beat over the past year.
Makes me feel good to say, and it might sound kind of corny, but it makes me feel good to say that I'm a part of a department like this. Any foreseeable, or I don't know if that's the right way to word it, but any long-term changes that you think might take place that may be permanent?
Well, I think that's a great, I kind of think that probably the vaccination mission, even when we get to a certain point, that's something that will probably be, that'll be in our That'll be a mission that we'll be doing for some time.
Okay.
We are also working on the mission of trying to figure out how we can help reach folks who are in their homes, homebound population. From what we can tell, that's thousands of people. So we're still working out exactly how we would do that, but it just makes sense for us to do that. It's what we already do. We already have units. We already go in people's homes. We're used to being mobile. We have 60 medic units on the street every day, our alternative response units. So that's something we're still trying to figure out. And I have a feeling that mission will probably stretch out for months in the future. I think some of the logistics things we'll be doing with PPE, we'll be doing those for a long time. So I think certainly some things have changed. One thing that hasn't changed, of course, is that dedicated service provided by all of our members, including you. I mean, we haven't missed a show during COVID either, I don't think.
No, I don't think we have. It's just the setup is different, but this is actually, dare I say, a little bit more convenient.
And the whole team at LaSalle TV, I want to acknowledge them too. I know it hasn't been easy. So it's been great to see. It's been a bright spot for me when I emerged from our emergency operations center to be able to see one of these episodes, and I'm glad I could finally make it on the show.
We're glad to have you, Commissioner. Are there any thoughts or messages? Navigating life right now is so stressful. So if there's any thoughts or messages that you'd like to share with those who've been consistently on the front lines, what would you like to say?
Well, I think I would say for the folks in the front lines, as well as our community members, don't forget the basics. We're still having fires. We're having a lot of structural fires. We had a very tragic year last year in terms of fire deaths. We're off to a very difficult start this year. We've already had 6 fire deaths this year, and it's only March. So I would remind folks still being safe around with fire, careful with smoking, heating, cooking, electrical. Those aren't always the main causes. So if you have those frayed wires on your phone charger, get rid of it and buy a new one. Don't run cords underneath carpets. Be really careful with heaters, space heaters. Be careful with smoking materials. Of course, be careful cooking. As we say now, don't be cooking if you ain't looking. So don't walk away from those pots, because we are still seeing. We know everybody's distracted with what's going on. You really have to remember the basics. The same thing goes for our members. Fighting fires is still dangerous. We do a lot of emergency medical incidents that are dangerous. Of course, it's a really tough time for the city right now. So we really want everybody to remember those things. And of course, make sure that you test your smoke alarm. And we're excited to get back out soon. We'll have our community action teams out there installing smoke alarms again proactively, and maybe even registering folks to get their vaccination. So stay tuned for that. We're always looking for new ways to help serve our neighbors here in the great city of Philadelphia.
Absolutely. And we want to remind everyone, we're still, as the commissioner just said, we're still working out logistics as far as, getting to the folks who are homebound and, touching on the message we just put out there. Don't forget, don't want to get complacent when it comes to fire safety, because we are in a pandemic doesn't mean that it's not going to happen, because it possibly can. And most of it, if not all of it, is probably preventable. Thank you so much, Commissioner, for taking this time out and conducting this little interview session with me. I really appreciate it, because again, you're a busy person and I totally recognize that. Remember, if you would like to find out more about us on LaSalle TV, you can check out our social media sites. And if you're interested in learning about the Philadelphia Fire Department, visit our Facebook, Twitter, and web pages. Also, check out Fireman's Hall, located at 147 North 2nd Street, and meet with our museum curator, firefighter Brian Anderson. I would like to once again thank our commissioner for joining us today, and thank you for tuning in and watching. So until next time, remember, fire is everyone's fight. Stay safe and remain free from fire.
Thank you all. Be safe. Wear your masks. Get vaccinated.
Thank you, Commissioner.